All right, guys, regardless if you're talking about the situation at hand right now in America or any situation in the near future, before you let your feelings and your emotions dictate how you're going to control the situation or figure out the situation, you have to learn to control to stop yourself. Don't use your emotions, don't use your feelings, use your brain. All you got to ask yourself is who is going to benefit and who is going to profit. If you can find those two things out, it's going to lead you to people, places, and things that's going to make everything go together. If it leads you to a person, you can take that person and say, hey, what's this person's character? How's this person act? Where's this person been? Who did they work for? What do they do during the day? What do they do at night? And one thing leads to another, guys, and you will put that puzzle piece together. Now let's get into the video. You guys are watching Talks with Ryan. Like, share, and hit that subscribe button, and let's get into today's video. All right, guys, welcome back to the channel. We've all seen everything unfolding right before our eyes. We've seen these governors, we've seen the mayors, we've seen police officers, all different kinds of law enforcement, and they're pushing to keep these lockdowns and these safety protocols in order. But why? Because we all know what government is. Even George Washington, the very first president, knew what government was. He said government is not reason and it is not eloquence, but it is force. And like fire, it is a dangerous servant and a fearful master. Because we know good and well down deep that these law enforcers and these politicians aren't out for the safety of the citizenry. They're not to make your life better or to make your lives easier. They have taken over the republic, the government that we, the people, stood for and created. It is now theirs. They're using it against us, which is the complete opposite from what it could be. So therefore, there's another baseline somewhere in this story that is fueling this fire, and like I filled you all in the beginning, who benefits and who profits. And that's what we're going to look at. All right, the first thing we're going to look at is a state-by-state breakdown of federal aid from the government to the state per COVID case. Each individual case is going to grant the state this amount of money. HHS recently began distributing the first $30 billion of the emergency funding designated for the hospitals in the Coronavirus Aid, Relief, and Economic Security Act, CARES Act. Some of the states hit the hardest by the virus will receive less funding than states touched barely by the virus, if that makes any sense at all. We're going to go to the bottom paragraph. Below is a breakdown of how much funding per case each state will receive from the first $30 billion in the aid. Kaiser Health News used a state breakdown provided. Now check this out, guys. California, $145,000 per case that is listed as a official CV case. Now some of the states aren't nearly as much, but I believe the biggest one I seen was West Virginia. I'm out of Kentucky and we got an outrageous amount ourselves. Indiana, $105,000. Kansas, $291,000. 260, $380,000 per case. That's for each case. So if they got 3,000 cases, that's 3,000 times 280,000. It's ridiculous. It's an ungodly amount. And this money's going somewhere. There it is, West Virginia, $471,000 per coronavirus case. Crap, I didn't mean to say that. Per COVID case. But still yet, there's more to this. There's a part 2 to this aid. This is part 1, the first $30 billion. I believe, if I'm not wrong, which we'll see in a second, there is another $20 billion to add on. This was phase 1 of the general distribution. The total was $50 billion to the medical providers. Bill fee for service in order to provide financial relief during the pandemic. The initial was $30 billion. nearly 320 providers who bill Medicare fee for services, an additional phase 2 of $20 billion, nearly 15,000 providers who bill for Medicare. And guys, this money is going to the state. I know they're saying it's for the hospital, but a Treasury Department's going to take it in. They're going to spend it accordingly. And who's to say that, we've seen, just like in a video I just did out of Nashville, they kept the case numbers hidden because they were so low. Well, why would they do that? Now we know. Because they're getting, what was it, $270,000 per case? I mean, it's almost like who wouldn't do it, but it's so unmoral that, I know myself and more than likely none of you guys would ever do that. But what kind of corrupt politician would not fall for this? Guys, this is the biggest heist on scale, on record, in the history of the world. They're even going out of their way to pad the numbers, but they're also going out of their way to even change the definition of what a death is classified under this new virus. This is, I believe she's some kind of health official out of Illinois, Dr. Naziki, I believe. But listen to what she says about how they classify a death that has to do with this virus, and tell me that it don't benefit them.
People dying of COVID. So the case definition is very simplistic. It means at the time of death, it was a COVID positive diagnosis. So that means that if you were in hospice and had already been given, a few weeks to live, and then you also were found to have COVID, that would be counted as a COVID death. It means that even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death. So everyone who's listed as a COVID death doesn't mean that was the cause of the death, but they had COVID at the time of death. I hope that's helpful.
And if that ain't enough, there's still more. Anytime healthcare interacts with dollars, it gets awkward. Right now, Medicare has determined that if you have the virus, admission to the hospital, you'll get paid $13,000. If that patient goes on a ventilator, you then get $39,000. Now that's 3 times as much as what you get from a regular admission. Nobody can tell me after 35 years in the world of medicine that sometimes these type of things have a certain type of impact.
How many have died from COVID-19 that do not have any other underlying health condition?
So nationally, the numbers are vanishingly small, in less than 10%. I think I saw something like 6%, and that might have been global numbers.
No, doctor, it wasn't a global number. It was from the United States CDC. 94% of the deaths from this virus had underlying medical conditions. According to the CDC, 9,683 people died that had no underlying conditions. The rest did.
So, in the general statistics, Illinois has been similar to what the aggregate larger numbers have. So I would say that it's going to be definitely under 10%, maybe even in the single digits.
Under 10%, maybe even in the single digits.
All right, lastly, I want to go over some statistics from around the world. 99% of those who died from the virus had other illnesses, Italy says. Well, that sounds awful familiar because the CDC report shows that 94% of all the deaths from this virus in the U.S. had contributing conditions. That leaves 6% that didn't. Just the other day, I screenshotted this off a Fox News article. 0 to 19 years old. Chance of survival rate, 99.997%. 20 to 49 is 99.98%. 50 to 69 is 99.5%, and 70 plus is 94.6% survival rate. Then we move into Australia. On a pie graph, when compared to pneumonia, heart disease, lung disease, stroke, Alzheimer's, dementia, cancer, there's COVID down at the bottom, 0.87%. Not even a slice of the pie graph. It's literally a freaking line on the pie graph. And when you get it into these tower charts, it can hardly even be seen. I mean, this is unreal. Guys, like I said earlier, this is a full-on heist. This is a bank robbery of the United States taxpayers. We pay taxes. Our government has turned tyrannical, and they are basically implementing these lockdowns and shutdowns to keep us out of the picture while they rob us blind. And before I go, last little note. 2008 Nobel Prize winner Luc Montagnier, the supposed inventor or the guy who found HIV virus, well, he claims that this COVID disease was artificially created in a lab by biologists who were working on an AIDS vaccine. And we remember what Rahm Emanuel said, never let a good crisis go to waste. So what do you guys think? Could the actual creation of a vaccine be the monster behind this whole virus? What we're actually shooting for was the reason it was created in the first place? I don't know personally, guys, but leave your thoughts in the comments section below. Make sure and leave this video a thumbs up and share it on all your social media platforms. And guys, make sure to subscribe to the channel if you haven't. And if you've been here for a while, double check and make sure you're still subscribed. Other than that, stick true to your freedoms, don't take any more crap from these tyrants, and stand up for your rights. And I'll see you guys in the next video.